My name is Dr. Robert Johnson, and for 23 years, I was a lung specialist at Charlotte Regional Medical Center in North Carolina. I treated people who couldn't breathe right, folks with pneumonia, emphysema, lung cancer, all the respiratory problems you can think of. I had my own practice, a good reputation, and I thought I'd seen just about everything a pair of human lungs could do. Last month, I closed my practice and stopped seeing patients. My colleagues think I'm retiring early. My wife thinks the job finally got to me. But the truth is something happened last fall that I can't explain. And it's made me question everything I thought I knew about how the human body works. I'm not a man who believes in things I can't see or measure. I went to Duke University for medical school, trained at some of the best hospitals in the country, and built my career on facts, test results, and x-rays. When a patient came to me struggling to breathe, I could usually figure out why within an hour. Fluid in the lungs, pneumonia, tumor, asthma attack. I'd seen thousands of cases, ordered thousands of tests, and I was good at my job. But what happened with Donald Williams last October changed everything. It showed me that our medical textbooks don't have all the answers, and that sometimes the human body does things that shouldn't be possible. Let me tell you what happened, and you can decide for yourself what it means. Charlotte Regional is a big hospital, over 400 beds with a busy emergency room and an intensive care unit where the sickest patients go. I'd worked there since 2001, seen it grow from a small community hospital into a major medical center. The ICU is on the 7th floor with big windows overlooking downtown, though most patients are too sick to notice the view. It was a Tuesday morning, October 8th of last year. I remember because it was my daughter Emily's birthday, and I'd promised to make it to her dinner that evening. I was finishing my morning rounds, checking on my hospitalized patients, when my pager went off. The emergency room needed me right away for a patient who couldn't breathe. I grabbed my stethoscope and headed downstairs. Dr. Linda Brown met me outside the emergency room. Linda had been an ER doctor for 15 years, worked in Miami and Atlanta before coming to Charlotte. She wasn't the type to panic easily, but when she handed me the patient's chart, I noticed her hand was shaking a little. "Patient's name is Donald Williams," she said. 54 years old, construction worker. No health problems we know of. Doesn't smoke, takes no medications. He came in about an hour ago because he suddenly couldn't catch his breath. Started this morning while he was working a demolition job. No chest pain, no injury, nothing that would explain it. But Dr. Johnson, his oxygen level is down around 78%. For those who don't know, your oxygen level should be 95 to 100%. 78 is dangerously low, low enough that most people would be passing out. Your brain needs oxygen to function. "What's his chest x-ray show?" I asked. "That's what I need you to see." She pulled up the x-ray on the computer screen. I looked at it carefully, then looked again. Donald Williams' chest x-ray was completely, totally normal. His lungs were clear. No signs of pneumonia, no fluid, no collapsed lung, nothing that would explain why he couldn't breathe. "Did you do a CT scan?" I asked. A CT scan is a more detailed type of x-ray that can show things a regular x-ray might miss. "Already done. Check for blood clots in his lungs. Nothing there. The scan looks perfect." I walked into the examination room and saw Donald Williams sitting straight up on the hospital bed, gripping the side rails. He was a big man, probably 6'2", with thick arms and the weathered, tan skin of someone who'd worked outside his whole life. Sweat was running down his face even though the room was cool. He was breathing fast, about 40 times a minute when normal is 12 to 16, and I could see the muscles in his neck straining with each breath. But what I remember most were his eyes. They were wide open, filled with fear, staring at something I couldn't see. "Mr. Williams, I'm Dr. Johnson. I'm a lung specialist," I said, moving closer to his bed. "I'm going to listen to your breathing, all right?" He nodded slightly but didn't speak. He was working too hard to breathe to talk. I put my stethoscope on his back and listened carefully to both lungs. Dr. Brown was right. His lungs sounded completely clear. No wheezing, no crackling sounds, no fluid. Just air moving in and out like it should. His heart sounded normal too. Steady rhythm, normal rate. No problems there. The monitor next to his bed showed his oxygen level at 76%, even though he was wearing an oxygen mask turned up all the way. That shouldn't have been possible with healthy lungs. Let's check his blood oxygen directly, I told the nurse. Draw blood from his artery and send it to the lab stat. While we waited for the results, I tried to get more information. Mr. Williams, can you tell me what happened? Were you around any chemicals at work? Any dust or fumes you might have breathed in? He shook his head hard, then managed to gasp out 3 words. They want in. Who wants in? I asked, but he just closed his eyes and kept fighting for breath. The lab results came back 12 minutes later. His blood oxygen level was 42. Normal is between 80 and 100. His level was less than half what it should be, but everything else in his blood was normal. The carbon dioxide, the pH balance, everything. His blood was fine. The oxygen just wasn't getting from his lungs into his blood, which made absolutely no sense with perfectly clear lungs. We need to get him to the ICU right away, I said. Let's get respiratory therapy up there and see if we can figure out what's going on with his lungs. We moved Donald Williams to the intensive care unit on the 7th floor just after 11 that morning. By the time we got him settled in bed 4, his oxygen level had dropped to 71%. He was breathing even faster now, 48 times a minute. At that rate, he'd tire out soon, and then we'd have no choice but to put a breathing tube down his throat and let a machine breathe for him. I called in Dr. James Miller, who ran our lung department, and Dr. Patricia Davis, another ICU doctor. Both came right away. Both examined Donald Williams. Both looked at all his test results and x-rays. Both looked as confused as I felt. Something's wrong with the x-rays, Dr. Miller said. Nobody looks this bad with normal lungs. I watched them take the CT scan myself, I said. I looked at every image. His lungs look perfect. Dr. Davis was listening to his chest again with her stethoscope. It's like the oxygen isn't crossing from his lungs into his blood, but if that was happening, we'd see it on the CT scan. There'd be some sign of damage or disease. Let's do a full lung function test, Dr. Miller said. Our respiratory therapist, Michael White, brought the testing equipment and spent 20 minutes trying to get accurate measurements while Donald Williams struggled to follow the instructions. When the results finally printed out, they made no sense at all. His lung size was normal. His ability to blow air in and out was normal. But there was one number that was completely wrong. The test that measures how well oxygen moves from the lungs into the blood. That number should be above 80%. Donald Williams's number was 12%. 12%. In my 23 years as a lung doctor, I'd never seen a number that low, except in patients who were actively dying from end-stage lung disease. Run it again, I said. The machine must be broken. Michael ran the test 2 more times. Same result every time. At 1:30 that afternoon, Donald Williams's oxygen level dropped to 68%. His lips were turning blue. His fingertips were blue. He was starting to lose consciousness. We had no choice. We had to put in a breathing tube and use a ventilator to breathe for him. Even with the breathing tube in place and the machine pushing pure oxygen into his lungs at high pressure, we couldn't get his oxygen level above 75%. It was like his lungs had turned into plastic wrap. The oxygen couldn't get through no matter what we did. At 3 o'clock that afternoon, I was standing at the nurse's station going through his chart again, trying to figure out what I was missing, when his nurse called out, "Dr. Johnson, come look at this." I ran to his bedside. Donald Williams was sedated and paralyzed, completely dependent on the ventilator breathing for him, but his oxygen level was going up. 78, 82, 87, 93. "Did you change any settings?" I asked the nurse. "Nothing." I looked away for a minute, and when I looked back, it was rising on its own. Within 10 minutes, his oxygen level was 98%, completely normal. I listened to his lungs again, still clear. I checked the ventilator, no changes. I looked at the monitor, no equipment problems. "Draw another blood gas," I said. The blood test came back perfect. His oxygen level was now completely normal. Dr. Miller stared at the results. It just fixed itself? But what was wrong in the first place? He didn't have pneumonia. He didn't have fluid in his lungs. He didn't have anything we could identify. "Let's try waking him up," Dr. Davis suggested. "See if he can breathe on his own." We slowly reduced the sedation medication over the next 2 hours. By 6 o'clock, Donald Williams was awake, following commands and breathing comfortably with the machine. We removed the breathing tube at 6:45. He sat up in bed looking exhausted but otherwise fine. His oxygen level on regular room air was 96%, normal. "Mr. Williams," I said carefully, "can you tell me what happened to you?" He looked at me for a long time. Then he said in a normal, clear voice, "They got in." "Who got in?" "The ones from the building. The old hospital we were tearing down. They got in through my lungs when I breathed the dust. They wanted a way in, and I gave it to them when I breathed." A chill ran down my back, but I kept my voice calm and professional. "Mr. Williams, you had a serious medical event, but you're better now. We're going to keep you here overnight to watch you, run a few more tests, and—" "You don't believe me," he interrupted. "That's all right. They're quiet now. They got what they wanted." We kept him in the ICU overnight for observation. His oxygen levels stayed normal. His chest X-ray the next morning was still clear. Every test we ran came back normal. I sent him home at noon on Wednesday with instructions to come back to my office in a week for a follow-up visit. He never showed up. When my secretary tried calling him, the phone number was disconnected. I tried to forget about the case. We'd had a patient with unexplained breathing problems that got better on their own. Strange, yes, but medicine has its mysteries. I wrote it up in his chart as severe low oxygen, cause unknown, resolved, and tried to move on with my other patients. Then 2 weeks later, on October 23rd, a 39-year-old woman named Barbara Smith came to our emergency room with exactly the same symptoms. Severe trouble breathing, oxygen level in the 70s, completely clear lungs on examination and x-rays, blood tests showing dangerously low oxygen that shouldn't be possible with healthy lungs. She worked for an environmental testing company. She'd been inside the same building Donald Williams' crew had been demolishing, the old Mercy Hill Hospital that closed in 1987, taking air quality samples the day before she got sick. When I walked into her room and saw her sitting straight up, using every muscle to breathe, fighting for air, I felt something cold settle in my stomach. "Ms. Smith," I said, "have you been near any demolition sites recently?" Between gasps for air, she managed to say, "Mercy Hill, old hospital, yesterday." "Were you wearing a mask?" "Yes, full face mask, proper filters." The same thing happened. Dangerously low oxygen levels that made no sense with clear, healthy lungs. Her test showing oxygen transfer from lungs to blood was 14%, impossibly low. We admitted her to the ICU, put in a breathing tube, used the ventilator. Nothing helped much. Then after about 6 hours, it just fixed itself. Her oxygen levels went back to normal. Her breathing returned to normal. Everything was fine. Before we took out her breathing tube, I asked, "Mrs. Smith, has anything unusual been happening to you? Anything you can't explain?" Her eyes, visible above the breathing tube, went wide with fear. She grabbed my hand and squeezed it hard. When we removed the tube and she could talk again, her first words were, "I hear them breathing inside me." We kept her for 3 days. Every test was normal. I had other specialists see her, infectious disease doctors, neurologists, psychiatrists. Nobody had answers. On her last evening in the hospital, she told me she'd been having dreams about the old hospital building, about people who died there, about lungs filling with something that wasn't quite air and wasn't quite water. I discharged her on October 26th. She moved out of state 2 weeks later. Her forwarding address was in Oregon. On November 2nd, a 16-year-old boy named Richard Wilson came to the emergency room. He'd snuck into the Mercy Hill building on a dare from his friends. Same symptoms, same impossible test results, same mysterious recovery after several hours. He told me he could feel something moving in his chest when he breathed, something that wasn't part of him. That's when I started having trouble sleeping. I'd lie in bed at night and dream about the inside of lungs. But they weren't empty spaces filled with air like they're supposed to be. They were crowded, occupied, filled with something that moved with purpose. I'd wake up gasping, checking my own oxygen level with the finger monitor I'd started keeping on my nightstand. I started researching Mercy Hill Hospital. It had been built in 1923 as a tuberculosis sanatorium, a place where people with TB went to be treated. Between then and when it closed, over 11,000 people had died in that building, most of them from lung problems. tuberculosis, pneumonia, lung cancer, emphysema. 64 years of people struggling to breathe in those rooms, dying because their lungs wouldn't work. The demolition was stopped on November 8th after a third worker from Donald Williams' crew showed up in our emergency room with the same problem. The city shut down the project, citing potential environmental hazards. But I knew better. They didn't know what to cite. How do you classify something that makes no medical sense? I kept working, kept seeing my regular patients with their normal lung problems, asthma, bronchitis, pneumonia, treating them with regular medications and procedures. But every night I'd review the files on Donald Williams, Barbara Smith, Richard Wilson, and the others, looking for the rational explanation that had to exist. But every time I listened to a patient's lungs with my stethoscope, I wondered what I was really hearing. Every time I looked at a chest x-ray, I wondered what the pictures couldn't show. Every time I ran those lung function tests, I wondered if the numbers meant what I'd always thought they meant. I stopped sleeping more than a few hours a night. My wife, Helen, noticed. My colleagues noticed. Dr. Miller pulled me aside on November 20th and told me I should take some time off. "You're too focused on those strange cases," he said. "Sometimes we don't get answers, Robert. You have to accept that and move on." But I couldn't move on, because I'd started wondering about all the other cases I'd seen over my career. How many patients with unexplained lung scarring actually had something else happening in their lungs? How many times had I written cause unknown in a chart when maybe the real cause was something I'd never considered, something I couldn't test for or see on an x-ray? The final moment came on December 3rd. I was doing a routine procedure on a patient, a bronchoscopy, where I put a thin camera scope down into the lungs to look around. As I moved the scope through the airways, watching on the video monitor, I saw something move in the corner of the screen. Not the normal gentle movement of the breathing passages. Something else. Something that pulled back from the light. I froze. I backed up the scope and looked again. Nothing there. The airways looked completely normal. But I'd seen something, or thought I'd seen something, and I realized I couldn't trust my own eyes anymore. I finished the procedure automatically, wrote up my report, went to my office, and sat in the dark for 2 hours. That night, I wrote a letter to the hospital administration. I said I was stepping away from patient care to pursue other opportunities, but everyone would know what it really meant. I submitted it the next morning and stopped taking new patients. My last day at Charlotte Regional was December 20th. I spent it finishing paperwork, transferring my patients to other doctors, and packing up my office. 23 years fit into 6 cardboard boxes. On my way out, I stopped by the ICU and stood in the doorway of bed 4, where Donald Williams had been. A different patient was there now, an older man with emphysema, breathing comfortably on oxygen through nose tubes. Normal, explainable, safe. I think about those patients every day. Donald Williams, Barbara Smith, Richard Wilson, and the others. I think about what they told me, about what they said they felt inside themselves. I think about that building where they'd all been, where over 11,000 people had died struggling to breathe over 64 years. The human lungs, when fully opened up, have a surface area about the size of a tennis court. All of that surface is inside your body, hidden, reached only through breathing. There are about 300 million tiny air sacs in your lungs, each one a microscopic cave where the air you breathe meets your blood. What else might be meeting there? I've applied for a research position at a university out in Oregon, far from Charlotte, far from Mercy Hill Hospital. I'll study lungs in a laboratory, working with cells in dishes and computer models. Controlled conditions. No patients who can look at me with terrified eyes and tell me impossible things. But I know I'll never look at a pair of lungs the same way again. The demolition of Mercy Hill Hospital was finished 2 weeks ago. The site has been cleared and graded. They're building condominiums there, fancy apartments starting at $450,000. I saw the advertisement online. It shows a modern glass building with big windows and the words, "Breathe new life into Charlotte living." I wonder how many people will move into those apartments and develop breathing problems. I wonder how many will end up in emergency rooms, gasping for air while doctors look at normal x-rays and shake their heads. I wonder how many lung specialists will see those cases, look at the impossible test results, watch the mysterious recoveries, and write them up as medical mysteries. I wonder how many will keep practicing medicine after they understand what I now understand. The average person breathes about 22,000 times each day. 22,000 times that air moves in and out of your lungs. 22,000 opportunities for exchange, for something to enter that wasn't meant to be there. My wife asked me why I keep that oxygen monitor on my nightstand, why I check my oxygen level before bed and first thing every morning. I tell her it's just habit from all those years working with lung patients. But really, I'm checking to make sure I'm still just me in here, that my lungs are still working the way they're supposed to work, that the oxygen moving from my lungs into my blood is the only thing making that journey. Because somewhere in Charlotte, Donald Williams is going about his life. So is Barbara Smith, wherever she moved to in Oregon. So is Richard Wilson and the others. They're breathing in and breathing out, their lungs working normally by every test we can do. But late at night, I think they check their oxygen levels too. I think they lie awake wondering what else is breathing inside them, sharing that tennis court-sized space inside their chests, living in those 300 million tiny air sacs. And I think they know, as I now know, that modern medicine has mapped the human body in incredible detail. But there are still places we don't understand, still spaces we can't see with our X-rays and CT scans, still possibilities that aren't in our medical textbooks. The lungs breathe. That's their job. In and out 22,000 times a day, from the moment you're born until the moment you die. But who's to say we're always breathing alone?